I'm Dr. Julie Pham, founder of CuriosityBased. We help people practice curiosity in the world, starting in the workplace, because that is where we spend most of our waking hours. Curiosity as a practice boils down to self-awareness, relationship building, and clear communication. So join us as we interview leaders to see how they use curiosity at work.
Hi, welcome to the Curiosity at Work podcast. I am Julie Pham, the CEO of CuriosityBased, and today I get to be in conversation with Bradd Busick, who is the Senior Vice President and CIO at MultiCare Health. Welcome, Bradd.
Hey, Julie. Thanks for having me. Good to see you.
Yeah, so good to see you. I know that we met years ago when you did a lot of board work, volunteer work, and in the technology space, and I was always so grateful for your community-minded approach to technology. So I'm excited for this conversation.
Thank you. Fun to see how the roads intersect, and I'm really glad to be with you today.
Yes. So Bradd, my first question for you is, who is one person that has influenced how you practice curiosity at work?
Yeah, this is a really awesome opportunity to highlight someone that was incredibly influential, both personally and professionally. And I think in this work that we do, Julie, the blurring of lines between personal and professional happens naturally because we end up spending so much time together. And this was a woman at the Bill and Melinda Gates Foundation when I was part of the strategy and planning and architecture team. And her name was Letitia Selk. And Letitia was a college athlete at UW, wildly involved in the community. And at the time of the Gates Foundation, we were scaling rapidly. Which meant we had to go give away $4 billion a year responsibly. And so if you don't know the Gates Foundation, you're like, well, of course, you should just be able to write a check and give away $4 billion. But Letitia actually challenged us to, I think, ask more why questions. What is it about this particular strategy that is going to unlock potential in a community that we may not know? Why would we distribute mosquito nets that would actually be black versus white in that region, and how it actually that impact adoption or utilization based on their social norms? Why would we want to go public with our portfolio of work and flight so that we can show our capacity relative to the demand, which of course we never had enough capacity for? And not only did she preach this, but she practiced it. And I think forced a lot of us who now have really awesome careers and opportunities in leadership positions at Pfizer. Some are still at the Gates Foundation. I'm here at MultiCare. Most of us have taken, I think, that practice of curiosity with us and are now modeling that same rhythm and order and discipline for our own teams.
It sounds like you get to learn along the way all those details. I never thought about a mosquito net being black versus white and what the impact would be. And it just takes that extra probing, and not in a defensive, why are we doing this or that? It's actually helped me understand.
Yeah, I think it was maybe a mindset of embracing uncertainty, where I think we were asked to help enable the mission of the foundation and all the programmatic work. And so I think adopting a posture of openness and mindfulness to say, like, I'm not sure, but let me find out. And I think being able to ask those critical why questions is something she did really, really well.
She sounds like a pretty special person.
She's incredible. And as you would imagine, those are the type of people that I would love to, surround myself with.
So Bradd, you're the CIO at MultiCare. What does that mean? How many employees are there? How do you work together? The kinds of functions?
Yeah, absolutely. It's a really awesome question, because if you've seen one CIO in a healthcare system, you've seen one CIO in a healthcare system. So healthcare, particularly here in the Pacific Northwest, our mission is to be local, locally governed, locally owned, and taking care of the people that live in our communities. And so we operate 13 hospitals. We have close to 30,000 employees. And the role of the CIO is to ensure that we take care of all the things that nobody cares about until they break. So these are laptops, desktops, operating rooms, internet connectivity, making sure that you can log on to MyChart, Julie, after you have an appointment with one of our providers and get your medication or access to your medical records. And healthcare is so wildly personal that you actually can't afford to have a downtime and you can't afford to have a break. And so when you think about security, and I think the importance of leading with both integrity, but also curiosity, the stakes are really high because I'm not doing this work to make money. We're doing this to enrich people's lives and heal and cure where we can. And so we consider IT part of the care team, meaning we are just as strategic as the arms and legs that are administering shots and conducting surgery, because without us, they can't do their work.
Oh, so that must take a philosophy from the top then to integrate the IT, not just to see it as, hey, you're to serve everyone else. It's actually to be part of that shared strategy in serving your
That's exactly right.
patients.
Yeah, I think there's an antiquated line of thinking that, IT is, in some ways subservient to the mission. As a matter of fact, it's not. IT isn't at the table. IT is the table. So the more modern healthcare systems today have people like CIOs that are now running the entire enterprise, because healthcare today is digital. And it actually takes an interesting mindset when you think about expanding access to care for people that are the marginalized that don't have access, or we call them, digital deserts or healthcare deserts. It's not okay to have to drive 200 miles to get access to care. So how do you come up with that strategy to go reach them where they are?
So of the 30,000 employees, how many of them are in IT?
Yeah, so I have 400 people in IT. And by percentage of revenue, headcount, bed count, capital, MultiCare IT is one of the lowest invested in the entire country.
Oh, really?
We are literally operating one of the most lean shops in the country, 5 years in the making. And we're able to do that because of the investments we've made in platforms and people. And every dollar we save in IT infrastructure is a dollar we get to go spend on patient care. And so we're really proud of that. And it doesn't come without its challenges, obviously, but it takes an entire team to row together to accomplish that work.
I can also imagine, though, that even if you have relatively low number, but you're more integrated,
Absolutely,
then you can
yeah,
actually be more impactful, even if your numbers are lower.
completely. I would say over the last 6 years of my tenure here at MultiCare, we've intentionally blurred those lines between IT, quote unquote, and operations, embedding technical acumen in the lines of business, right? So we have clinical informaticists, Julie, who their entire job is to be bilingual. They speak clinical and technology. And so when you think about the complexity of that work and asking the right why question, you have to approach it with your palms empty, because if you already have something in your palms, you don't have any room to accept, well, this is why we check a patient in this way, because that workflow in that market in Yakima could be very different than the workflow that we have in Bellevue based on the patient demographic or need.
So of the 400, what are the range of functions? You already kind of mentioned it where you said that they're these, did you call them translators or what was it?
I mean, what clinical informaticists, yeah.
So what does that range? Because I'm assuming this is not just the IT help desk and the people who put together the servers. Who's working in this department?
It is an incredible crew of some of the most talented technicians that I've had the privilege to work with, and it ranges from a couple that you mentioned, right? We have your service desk, like the place you call when it's like, hey, I'm locked out of my computer, to our end user compute team, and they're the ones out literally in the field fixing keyboards, mice, monitors, cameras, cables, cords, TVs. Then you have your infrastructure team, all the stuff behind the scenes, servers, your Wi-Fi, your internet, and we have teams that support interoperability. So when you have all of these platforms that talk, someone has to make the systems talk. All the way to our clinical informatics team that I had mentioned, that's like at the what we call the sharp end. So dealing with our clinicians in the hospitals, to our cloud engineering team and our security team, which is one of the scarier parts of healthcare today, because healthcare is a target. And so this entire team, honestly, is an orchestra, and it makes up a really beautiful symphony of patient care. And we're really proud of the work that we get to go and do on behalf of our patients.
Did you have to grow during the pandemic because there was more remote care?
Yeah, we stretched ourselves in a lot of ways. When you think about some of the rules that in some cases had to be created and in some cases had to be broken to support patient care during COVID. Think about this idea that PHI, or the type of data that is, protected health information, we wouldn't let it leave our four walls. Like, it had to stay within MultiCare. But when you can't get in the four walls because of COVID, and you're setting up field hospitals and the National Guard is in your parking lot, or you are stuck at home but you need to talk to a doctor, we have to leverage modern platforms. And I will tell you, embracing uncertainty and saying yes to curiosity in terms of reinventing healthcare all took place during COVID. And it forced us to partner in different ways. And I think we as a society have adopted social norms now that we didn't previously have, like the ability for you to pick up your phone and meet with your doctor. So, like, to quantify that, Julie, we were doing 300 telehealth platform visits a year pre-COVID. In the year of COVID, we did like 345,000.
Wow.
So that just tells you, like, that didn't exist. It was a novelty, and now it's become a social norm.
And
so those
did
are
your
the things.
team grow?
No, we shrunk.
Wow.
Which means we had to say yes to platforms and scale as opposed to point solutions.
So we've been talking about how you've been doing this specifically in the healthcare industry. What is an example of practicing curiosity that is specific to healthcare?
Healthcare is a really interesting industry in that we are tasked and incented to model things like psychological safety and what we call an HRO mindset. An HRO mindset at MultiCare stands for a high reliability organization. And that means if you and I work together and I see something that is impacting the health or safety of our patients, Julie, I don't care if you're the CEO or if you are an EBS worker that's cleaning the room, you have the ability to call a safety pause. And a safety pause just says, I'm not comfortable with what's happening here because I see, in this case, an instrument that's missing off of the tray that should be there. Where is it? Is it near the patient? Is it in the patient? Is it on the floor? Or do we not have the type of equipment we need for the procedure that we're about to have? Or did the wireless just go down? And so this type of curiosity, we have what we call a preoccupation with failure. And this has been led by our Chief Nursing Officer, June Alteris, who's retiring in 2 months. And she brought with her this entire practice of embracing a questioning mindset, where we're incented to question one another, and not from a place of defensiveness, but to simply look each other in the eye and say, do you feel safe? Well, in order to do that, you have to have a level of psychological safety with me, regardless of position and title. And I have to have a level of trust and comfort with you in order to talk straight. And so we've been able to embrace that together, and it's why our quality outcomes are continuing to grow, and our culture is what it is today.
I love that, a preoccupation with failure.
That's right.
And it makes me think about how if you don't have many people reporting failure or mistakes, that doesn't mean that you don't have mistakes. It means that people aren't reporting them.
That's exactly right. And I would say in healthcare, where the stakes are wildly high, we can't afford to be unsafe, right? It's part of our core values, but it also is something that we incent and we highlight in what we call safety stories. Every single meeting, we would say, Julie, would you like to start out with a safety story today? And Julie would say, I would. Last week during a procedure, we realized that a patient hadn't had enough anesthesia. And so rather than proceed forward, we stopped the procedure and canceled it and rescheduled it to make sure that that patient had a safe procedure overall.
And it's not just the medical side, the healthcare side that's doing that. Even the IT, they have their safety stories too, you're saying.
We all have safety stories. And sometimes my safety stories in IT are clinical safety stories, meaning a patient went in for a procedure and saw that there was a red blinking light on one of the pieces of equipment in the room. And he or she asked what that was. And we found out that a machine wasn't on and the camera wouldn't have recorded that particular procedure that we wanted to record. So we rescheduled the procedure. And then what did we do to fix it? So to prevent it from happening the next time? And I think there's a cultural phenomenon that happens when you make it okay to talk about failures. And that's been one of the most impressive things here at MultiCare that June has both led and brought.
Mhm. So you talked earlier about how during the pandemic there was so much pressure, and that really forced people to be curious, to try new things. Can you talk about when is it hard for you in particular to practice curiosity at work, and how do you handle it?
Yeah, I think a lot of times people maybe confuse practicing curiosity with urgency or speed. And I I would say that I get challenged a lot with embracing both a questioning mindset and curiosity during a clinical downtime. And the clinical downtime for us, Julie, is when something's gone either planned or unplanned. A planned clinical downtime is like when you go reboot your phone at night and it installs the latest patches. Our clinical teams know it's planned for, it's a custom, we have the playbooks for it, and we know how to do it. If you have an unplanned clinical downtime, the questioning mindset goes to what's broken, how do you fix it, what's our fastest time for resolution. And I've had enough of these in my career now to know that the way that we do this best is when we actually step back and look holistically at the problem rather than chasing towards what we think a solution is. Because you could get an hour into something and find out that it's not that. And meanwhile, we've got your loved one and my loved one on the table or waiting for an appointment. And so being thoughtful and balancing both urgency and time with the appropriate curiosity, I think, has gotten us a better outcome over the last 6 years.
Brad, you're making me think about how there's this stereotype of IT folks being super focused on the feature
Yeah.
and not on the overall,
The
and to
solution.
step back
Yeah.
to go, huh.
Yeah.
Hmm.
I that's actually beautifully said. And I would say whether it's something we're rolling out for patient experience or all the things that again that nobody cares about until they break, I feel like our team has actually grown a lot in being able to step back and holistically say, let's not admire the problem, but let's also quickly diagnose what we think we can, making sure we have both the left and the right accounted for. And that's been a journey for us.
And that I'm sure takes a lot of modeling as well,
It
and making
has,
sure
and
that
I've
it's okay.
yeah, that's right, and making it safe to do. That's exactly right.
Mhm. So, Brad, can you tell me what is one thing that is sparking curiosity in your own life outside of work?
Yeah, as an IT guy, you'd think it probably involves servers and gaming or desktop or something at home. Um, what's been really, really therapeutic for me and has sparked a wild amount of curiosity, reading, listening, watching, is actually collecting and repairing vintage watches.
Oh,
So I started about 2 years ago collecting vintage watches from the 50s, 60s, 70s, and in some cases they're project watches, so repairing them. I'm not handy at all. And I mean, like my wife will tell you, like we have the handy guy on speed dial. But this has forced me to do through learning is watch a ton of videos, listen to people that do this best, and then get the right tools to be able to try it myself. And the worst thing that happens is I try it and it fails, and then I can defer to expertise and phone a friend. But it has been incredible for me to like sit down and unwind and actually watch the data around my own health, heart rate, pulse through this little magic Aura ring when I'm engaged in that type of work. And it's a great way for me to unwind. And so I've been embracing that over the last couple of years.
wow. When you sit down to do this, how long will you spend in just
Couple
one?
hours. Yeah, a couple
Wow.
of hours. I mean, imagine a watch with watch parts spread out all over a towel because some of them are so minute. I mean, I have an eyepiece hooked up. I've got little tweezers and we've got the right oil and sequence and I film it because I need to be able to understand how to put it back together because it's so complex and I'm not trained in this, right? And so it's been a really awesome way to embrace, I think, again, both a questioning mindset, but trying to become maybe more of an expert in that space.
Mm. Brad, thank you so much. That is the first time I've ever heard fixing vintage watches as a source of practicing sparking
You
curiosity.
bet. You bet.
So, Brad, if people want to get in touch with you, how do they do so?
Yeah, you can find me on LinkedIn. It's Bradd, Bradd, last name Busick, Busick, and I'd love to engage with you, connect with you, hop on a call. I believe in the power of networking. I believe in the power of relationships. And I think that's one of the platforms that facilitates that.
Bradd, thank you so much for your insights. Listeners, thank you for listening to the Curiosity at Work podcast. If you ever need any support practicing curiosity in your workplace, please reach out to us at CuriosityBased. And now go practice curiosity at work.